Отлично.
Hello, everyone. Thank you very much for coming. We are glad that you're with us today on our webinar about IDs to go and telemetry solution during COVID-19 context. And we are continuing our autumn sessions of webinars that we are performing during September, October, November, and December. We do it in different languages, and we understood that we do it most of all in Portuguese in Germany, and really need to repeat English one. So we are doing it for our potential distributors and all people who are interested to know more about telemetry solutions and our products that we perform worldwide. So how we will do now, I will share my screen with our presentation. We will introduce ourselves more and we'll go through our webinar program. For sure, you can ask questions. We have here chat and you can write it, and during our webinar, and for sure when we will finish, we will answer all questions that you want to ask us. So I will start sharing the screen. All of us now worldwide have a big challenge, is COVID-19, and for sure everything changed very quickly, and we see now second wave worldwide in many countries. A few words about our company, SK Telemed GmbH. It is a company based in Vienna, Austria, and we are digital healthcare provider. We do different products for healthcare, and we help to develop the level of performing of healthcare, make better the patient's care with our modern technologies, with telemedicine and telemetry. We do it with a big team of developers and sellers and lots of people already in our offices, first of all in Vienna and other places. We do smart solutions, user-friendly, and you will see our experience in many countries. So here is our world market positions. You see that we have representative offices in Brazil, Ukraine, Austria, Poland, Paraguay, and also we do distributor model. So in other countries, we're looking for distributors or interested in our products and support them, teach and give the technology, how to use it, how to sell it, and to show it to the doctors, to the hospitals, to the customers. And let me introduce myself, as I have started first as the host of this webinar. My name is Catherine Chuchilina. I'm an International Expert Director of SK Telemed GmbH, and today I'm going to share my knowledges about telemetry solutions during this webinar. And please, I want to introduce Mr. Sergey Kusevlyak. He is PhD in epidemiology, and please introduce yourself.
Oh, it's not only epidemiology. Hello, colleagues. I'm a doctor. My first degree is doctor, and then management in healthcare. But I'm already 30 years in medical business, and our experience with production, distribution, sales, maintenance of medical devices, modern technologies, diagnostic treatment worldwide. We dozens of years we spent distributing of most advanced products from USA, Germany, Brazil, in other markets like CIS countries and Asia. But last 11 years we pay attention and now making main business in IT solutions for healthcare and technologies. And success arrived 6 years ago, and now we're growing very quickly. Company grows last 3 years 5 times, and now we have only developers. We have team of coding developers, more than 100 people. And our success and experience with medical information systems, with telemedicine solutions, with telemetry technologies and complete ecosystem which we built 3 years ago, now meets huge success, and we expand our background, and we expand our, let's say, success story to other markets. So we can share with you all our experience of thousands of clinics, of many, let's say, a lot of doctors and millions of patients which use our solutions. And we will focus you on absolutely cutting edge and demanded as the most demanded in current situation with COVID epidemic and booming growth of our business. We will share with you, and I wish you, all of you, also growing and booming business of your companies in your countries together with us. Okay.
Thank you. Please, for us also, it will be interesting to know more about you. And if you see where is a chat, please use it to write us also your name, the country, and area that you're working. Will be also very interesting for us to see it. And we will go further. Just to show overview about our webinar program that we're going to speak about today. So first of all, we will speak about use of modern telemetry systems in public and private health for remote diagnostic of patients with chronic disease and with COVID-19 during epidemic and post-epidemic period. We will talk about cloud-based systems for collecting, storage, and interpretation of diagnostic data as a powerful medical instrument for on-time treatment. We will show you examples of telemetry use worldwide that we experienced, and of course, we will demonstrate how our telehealth medical diagnostic system IDIS2Go works right now during our webinar. We already prepared our IDIS2Go, and our engineer Sergey with us also to help perform this demonstration. And we will answer all questions that you will going to ask. And this slide is a point about the whole general situation in telemedicine market. I'm sure that in every country that you're right now based, you can see the booming growth of demand for telemedicine solutions, because it is really sometimes dangerous for life to go to hospital if you have some chronic disease, for example, and just enter to the street and go to doctor in a situation of pandemic would be really dangerous for life. So telemedicine is growing, telemedicine is on demand, and we are here with our product to be part of this worldwide growth demand. Here I want to show you the today statistic of COVID-19 growth. You can see, I think all of you use Glucometer to see the current situation. You see the leaders, and we now see the second wave that is growing. Lots of cases, lots of patients in Europe, and still the leaders keep them first places. I think about 4 months they are leaders. USA, Brazil, and India, they are leaders. But Europe also, and the Latin American countries and others keep growing. And here we see Iran, for example, on 13 rank, Iraq on 15. So we really don't know now when it will go to an end, and we still are in this situation.
And this situation pushes us to provide our solutions as wide as possible, because today we will explain you about our very successful already telemetry solution for remote diagnostic. and interpretation of diagnostic data at this to go. But next time we will talk about absolutely advanced monitoring of COVID patients solution, Shotodog. And we are happy to help people because every day thousands of people need care. And this growth of COVID patients let's say kicks out other patients from doctors' attention, and it is to go. It is solution for remote diagnostic and for the diagnostic in the place of patient lives or works, and it will help not only for COVID but for the rest of patients, because we know that after 20, age of 20, more than 40% of population has chronic disease, and this chronic disease now growing and complications growing, and number of deaths, for example, from cardiology reasons, is grows because COVID patient flow replacing other patient flows, common patient flows for treatment, for control of treatment. So it's very important to pay attention to COVID, and much more important to pay attention to other groups of risk, of first of all of chronic patients, of elderly patients. So all population of aged after 20, after 30, after 40 of people needs more care remotely, because clinics, hospitals are busy now.
Absolutely agree with you, and here is few more information about telemedicine market that is growing with a percentage. The telehome market sector and teleconsultation service sector are growing very quickly, and I want to give the word to Sergey about the new paradigm in world public health.
Yes, COVID pushes public health to change. It is absolutely new era now where public health system appear. This is after COVID start era. We can divide before COVID and after COVID start. And public health paradigm is changed. If before COVID, last year or last winter, a lot of discussion was in public health. Is it so necessary? Is it so important to implement telemedicine solutions? Maybe let private sector to use them. We will see. Maybe we will not. We need not to invest. Maybe it is not so important.
Not in time.
Not in time. Yes, and we have more valuable tasks and for our finance. But COVID epidemic with absolutely crisis of medical resources, of doctor time to take care about patients. Now all world wake up in situation where public health should develop and maintain strong and wide, very well developed telemedicine infrastructure. And this telemedicine infrastructure should help now and should exist in the future, waiting for next epidemic. Or we never know, maybe is this COVID will not finish, we will face another virus, nobody knows. So this change of paradigm, this digitalization is obligatory, and telemedicine infrastructure should be developed by public health finance as an infrastructure for public health care. Oh, a few words about types of workflow. Again, let's structure a bit. Let's not only structure, but let's take the same idioma, the same language to talk in the same idea level. So let's fix the telemetry. This is the transmission of diagnostic data from place of patient to place of doctor, to place of use. Like ECG, inside hospital, patient monitor data transmitted already half of century. But in the field, it is not so widely developed before. It was not before. Teleconsultation, it is doctor or medic specialist providing professional advice to another medic or doctor or nurse. It is needed now, for example, for infectionist consultation to GP, to family doctor. You can imagine that the number of infectionists is 1,000 less than family doctors. But professional advice how to treat a heavy patient should run from infectionist level to family doctor, to anesthesia, ICU unit, to hospital level. So doctor-to-doctor consultation in COVID situation is necessary, is needed for professional advice. And remote patient home consultation. This is case where family doctor consulting his patients which are normally wired to contract, public contract or insurance contract, to the population which he takes care about. Mm-hmm. So this is what we also developing a lot of products for online chat, for video chat, but chat is important, but not so, because doctor, if for example he has 20 or 50 patients and he would like to control daily their change of status, he has no time to spend 10 or 15 minutes to every patient. So it is important to have platform for monitoring of health status even without video chat. Mm-hmm. Okay.
Yes, thank you. And I see that some people introduce themselves. Here we see Wael Lotfi from Qatar, modern medical technology company. We are glad that you are here with us. Thank you. And we see good evening, Mehran from Iran. Hello, Mehran. And we see that here is Moy Hamedani from Iran, from Mavarai Fonun company.
I was in Iran some years ago, beautiful country.
Great, thank you very much for introducing here. And here is Kapilesh from Oman. Nice to meet you. Hello, welcome, and let's continue. So we want to show some successful use cases of providing of IDs to go, but I think that first we need to introduce a product. That telemetry solution for remote diagnostic is a product of SK Telemed, and it has all ISO certificates and CE documents, declaration of conformity of devices that we're using connected to our platform. It is open platform with number of portable connected devices that you will see, and it's absolutely brilliant for remote locations. And doctor from any place, from hospital or from home, can go to cloud on his computer or phone to see diagnostic results of patient that he receives. We will show you how it works. And
let me say some words about concept of this system. As the father of the system, we developed the idea to create a system independent from any hospital information system. Of course, we have our own medical information system for ambulatory, for hospital use, but when we think about telemetry solution, we from first day understood clearly that it should work independently, because in various hospitals in different countries there are a lot of different information systems, or without. Some hospitals work without information system. So we decided to create independent cloud storage and independent doctor interface to easy access to diagnostic data from any place. So our independent web interface, you can open from smartphone, you can open from any computer, from tablet, have access, and immediately your doctors can use this data about patient and make decision or give conclusion about this clinical case to nurse, even without any video, just to have phone call between nurse, which is remotely, for example, visiting patient at home, and doctor who is, for example, sitting at home, not in the office even, and look at the clinical case and say how to manage this patient immediately, for example. This is one first important part of concept. And another is that we created open platform to wire as much devices as possible. Of course, basic number of devices was universal, like patient monitor. It is 12-channel ECG, it is blood pressure, it is SpO2, it is temperature, but we added valuable, as for our opinion, positions like fast urine analyzer with 11 or 14 tests, of course blood sugar, and now we increase in ecosystem with digital stethoscope, with digital otoscope or dermatoscope, with laboratory for white cells counting, for hematology, for lipid testing, Glucometer. So we are adding more and more devices because various places of use, various use cases needs various sets of these diagnostic tools. And third idea is to apply artificial intelligence. We cooperate with modern developers of artificial intelligence, and now happy to provide automated interpretation of ECG, because as for our opinion and as per our experience, more than 80% of GPs, of family doctors, are not so versatile experts in ECG interpretation. So doctor can see the deviations, doctor can see the discrepancies between normal and abnormal, and some also some advices, and anyway he can understand that it is some abnormality and use this information immediately, or send this ECG to a professional for confirmation of diagnosis for ECG, for example. So go ahead, please.
Now we are going to show you a short video about some examples of using of IDs2Go, and before that I want to read more about our participants. We have here Mustafa Sultan from Oman. Hello, Mustafa. Aida from Iran. Hello, nice to meet you. And Lejo Thomas from India. Very nice. And Behnas, hello, Behnas. Thanks for coming. And now I will show you this short video about IDs2Go in English.
Introducing IDs2Go, a telemetry solution for remote diagnostics, giving high-quality results online, wherever your patient may be. IDs2Go, it's an integrated diagnostic system to go, an open platform for remote diagnostics with multiple connected devices. With IDs2Go, the doctor can link any Bluetooth-capable medical devices. In our current offer, IDs2Go supports a glucometer, urine analyzer, spirometer, infrared thermometer, a pulse oximeter, a 12-channel electrocardiograph, a blood pressure tonometer, all via Android tablet and contained in a smart lightweight bag. The doctor has remote access to all diagnostic data. IDs2Go already helps doctors in Austria, Ukraine, Paraguay, Kazakhstan and Poland. Dr. Walter works in a city hospital. He takes a call from a patient who needs help. Professionals have already scheduled remote consultation hours today for patients who have problems with attending hospital in person. The main target patient groups of IDs2Go are people from rural or remote areas, elderly people, disabled, or people with chronic diseases, and busy people who just can't find time to come. Dr. Walter hands his bag with IDs2Go to the nurse. It serves as an extension of his professional hands. He need not travel to the patient. All necessary data will be received via IDs2Go cloud on his computer. The doctor's assistant, Martin, visits Peter, age 74, after a stroke. The IDs2Go hold-all is lightweight and convenient in use. Martin measures blood pressure with a tonometer, which is connected to IDs2Go app on Android tablet via Bluetooth. He measures Peter's oxygen saturation and pulse rate with a pulse oximeter. And performs a glucose test with the Glucometer. All data is transferred directly to the IDs2Go portal. Dr. Walter accesses it using a unique case number. He observes it and he gives his recommendations. It's convenient and time-saving for the doctor, and it's right on time for the patient. IDs2Go is especially useful for remote regions. Crane operator Victor feels pain in his chest. Paramedic Karina is right there with IDs2Go and its 12-channel ECG. In a few minutes, all Victor's cardiography data appears at the doctor's computer. If there's no mobile internet connection, the data is stored on the tablet and transferred to the doctor when connection appears. IDs2Go Cloud also uses AI for data interpretation and doctor decision support. Dr. Walter gives recommendations to Karina and an ambulance is on the way. Eva can't use her legs after a car accident. It's more convenient for her to make a regular checkup at home. IDs2Go is here. The nurse Anna is monitoring her breathing function with a spirometer, and all data is already on the tablet. A urine test takes 1 minute. with all main parameters checked. An infrared thermometer completes the basic package of IDIS2Go. Proper treatment from the doctor and any necessary adjustments are readily provided to Eva there and then. The IDIS2Go platform is open to new equipment. We can connect Bluetooth medical devices that the doctor needs, a dermatoscope perhaps, stethoscope, a fetal Doppler, and so on. There are two main options in IDIS2Go modules. The first with a tablet on Android, or the second, patient monitor. The doctor can increase mobility of care, and the patient gets wider access to treatment. That is why society is choosing IDIS2Go.
Thank you for assisting.
Yes, so colleagues, you see that this system now during COVID epidemic can be used not only in the point of care, but also to visit chronic patients, because chronic disease patients like cardiology or diabetes are the main group of risk for heavy COVID infection. And it is obligatory to avoid them to visit hospitals, to decrease risk of infection in hospital. And care for these groups, group of risk is absolutely necessary to continue, because you never know when this epidemic finish, but chronic patients need continuous care. So for this case, IDIS2Go use is absolutely solution.
Yes, and as we see, and as you have assisted in the video, the doctor have remote access to diagnostic data, and also we use artificial intelligence to support doctor decisions, meanwhile in interpretation of ECG, and we use offline and online data storage in case, for example, it is no connection, no internet, no Wi-Fi in some very remote area. IDIS2Go keeps all the data till the connection appears, and also
and then transmit.
Yes,
then transmit to cloud. Yes.
And what is also a feature of IDIS2Go, it has open API, so it can be integrated in medical information system that is already used. But what is good?
Yes. If clinic has a working hospital information system, we can easily, we have a description of API, and transmission of diagnostic data will be done easily and will store in medical information system as simple laboratory data, diagnostic data in international HL7 standard. Everything is absolutely.
And in case doctor doesn't have any kind of medical information system in a small clinic, for example, in some village somewhere, everything that he needs is an internet, a computer, or the mobile phone, and he can enter to our cloud IDIS2Go and see all the results.
Yes, we discussed some clinical cases and user cases with our Indian partners this week. And for simple workflow, even it is small clinic with paper and a paper card for patient, but every diagnostic case has its unique code with number. You will see it now. And nurse sends this code to doctor by SMS, for example, or by phone, and doctor fix this code in this paper card. And IDIS2Go cloud storage keeps this data, and only in the paper card or electronic card you should keep the numbers, the code. You should fix this code, and in months, in half of year, coming back, revising this diagnostic data, it is easy to analyze what was before, what was half year ago, and or months ago, and what is the changes of today, and how to change the treatment protocol for this patient, for this clinical case. So it is prepared for very easy start in any situation when hospital or clinic or doctor has no information system or has versatile information system. It is prepared for any user case.
Yes, and it is prepared for any patient location. And now here you can make quick overview about devices that is already connected for IDIS2Go, and you have assisted it in a video. And now basic IDIS2Go kit, we have 12-channel ECG, blood pressure monitor, infrared thermometer, urine analyzer, glucometer, and spirometer. And also you can see some options devices that we also wired to IDIS2Go: dermatoscope, digital ultrasound Doppler, lipid testing system, gamma analyzers, otoscope, stethoscope. We will show it also right now to you. And it is time to show some examples. I want to go back to start from the example that were before introduction of IDIS2Go's example in Ukrainian implementation. Here is more than 2,000 IDIS2Go are working. Sergey, please help us to describe the whole situation of the big project of telemedicine on the government level that were made here in Ukraine.
Yes, it was a project started 2017 with a new law for improvement of rural area family care, and government issued this project for 3 years, 2018 to this 2020, and they built some hundreds of new ambulatories, point of care, but mostly reconstructed existing network, because network it is about 4,000 in the rural areas in Ukraine, and they spent money for reconstruction, for equipment, and for implementation of information systems in these ambulatories, internet connect, of course, training, computer purchase, and telemedicine solution. And we participated in this part of project for implementation of telemedicine network, and successfully equipped. And now we have analyzed, I think in July, last questionnaire was in July, about satisfaction of people who use, and we are happy to see that more than 85% of doctors use in these ambulatories. They use mostly, of course, mostly in the office, in the remote points of care ambulatories, yes, but also they use at home, and these cases shown in video are absolutely alive. There are alive patients, alive clinical cases after stroke, after accident, car accident. So it is absolutely true. Mm-hmm. And country is happy. Management of healthcare in these districts, in these provinces, is happy. And after first year of success, 2019, this year we are not doing any promotion, any additional promotion. Ecosystem selling itself.
Yeah.
Good feedback spreading out, and people asking only for that. This is a very nice example.
And here is the video from the Ukrainian news. We have supported this with English-speaking subtitles. I will reduce the sound because in Ukrainian, just to see from news.
Це медична амбулаторія у Великих Гаях Тернопільського району. Одна із 154 сільських амбулаторій, яка отримала сучасне телемедичне обладнання. Зараз дізнаємося, що це і як воно працює. Медична сестра Ірина Береза готує до обстеження місцеву жительку Зіновію Брик. Записує дані про пацієнтку в її електронну картку. За допомогою телемедичного обладнання вимірює артеріальний тиск. За результатами обстеження Ірина Береза виписує рецепт на отримання препаратів за програмою «Доступні ліки».
Це електронний рецепт. Пацієнту приходить смс-повідомлення, і за цією смс-кою людина звертається в аптеку, які також працюють по тій програмі «Доступні ліки».
Зіновія Брик розповідає, через високий артеріальний тиск в сільській амбулаторії обстежується щомісяця.
Цим апаратом користуються перший раз. Відчуття нормальне. Висока, як сказати, апаратура на вищому рівні.
There is different cases. For example,
обстеження триває 30 секунд.
ECG.
Телемедичне обстеження важливо в тому випадку, коли цей пацієнт буде продовжувати консультуватися дистанційно. Якщо, наприклад, наш пацієнт має кардіолога, з яким він постійно консультується, то це дуже зручно, що при зміні його стану, якихось нових скаргах, чи просто потрібно проконтролювати ту кардіограму, йому вже не потрібно їхати, наприклад, в якийсь заклад спеціалізованої медичної допомоги, а просто, приміром, по вайбу.
Here was the example of small ambulatory in Ukraine, and if we start with Ukrainian example, let's continue with other interesting case, because it is not only ambulatories and small hospitals which use IDIS-to-go system, also we has experience of using IDIS-to-go in prisons.
Yes, it was a request to improve availability of prisoners in a first of all, in small prison where there are no medical point of care.
Here also a video with English subtitles.
Впровадження сучасних технологій в систему охорони здоров'я не оминуло і підопічних Центру охорони здоров'я Державної кримінально-виконавчої служби. Нещодавно до медичних частин філій Державної кримінально-виконавчої служби надійшли діагностичні комплекси мобільної діагностики ІДІС 7500. Мобільний діагностичний комплекс ІДІС 7500 дозволив об'єднати медичні діагностичні прилади ранньої діагностики захворювань в компактний рюкзак.
Ми раді, що в медичній службі з'явилася уніфікована технологія обстеження хворих незалежно від місць їх перебування.
Мобільний діагностичний комплекс включає в себе 12-канальний ЕКГ, тонометр, пульсоксиметр, спірограф, термометр, аналізатор сечі та глюкометр. Перевірити стан роботи серця тепер можна у кожному медичному підрозділі. Дані кардіограми одразу відображаються на моніторі мобільного комплексу. А також лікарю доступні дані автоматичної розшифровки кардіограм.
Застосування штучного інтелекту для розшифровки кардіограми дозволяє оперативно приймати рішення щодо необхідності подальшого лікування чи госпіталізації хворого.
Можливий регулярний контроль функції дихання. Проведення спірометрії допомагає дослідити функції зовнішнього дихання та виявити порушення, пов'язані з захворюваннями дихальної системи. Результати можна одразу побачити на моніторі, що спрощує зчитування даних спірографа.
Також взяти під контроль якість надання медичної допомоги персоналу ДПЛС. Для цього треба створити складову в єдиній медичній інформаційній системі, яка відображає стан і якість надання медичної допомоги персоналу ДПЛС.
In fact, more than 18 months they use 120 units in peninsular system of Ukraine. They are happy and now already paying for next year cloud service.
And we are continue to going on our examples of using worldwide, and now we're turning to Latin America. And here is also the news from Paraguay about implementing of IDIS-to-go. It is in Spanish with English subtitles also.
Un aparato de telemedicina que nos acerca por lo menos más, ya los pacientes no necesitan llegar hasta el hospital regional para hacerse sus estudios, como por ejemplo el electrocardiograma, control de glicemia, espirometría, y todos estos estudios se cargan en una plataforma, se le da un código al paciente y a través de su celular o una computadora ellos pueden acceder a sus resultados. Aproximadamente 10 a 15 pacientes por día estamos agendando.
Es un aparato muy importante para la comunidad.
La verdad que sí, por el tema de la accesibilidad más que nada. Como no hay mucha salida de la ciudad, o sea, de Borja a la ciudad de Villarrica, les facilita bastante. Tienen que, o sea, tener un smartphone o una computadora y a través de eso pueden acceder a sus resultados. Y la verdad es más rápido y también no hay posibilidad de que pierdan, por ejemplo, sus estudios como en algunos casos sucede. Y más bien el control, o sea, los controles de los pacientes hipertensos, los diabéticos, más que otra cosa. Los pacientes se acercan o también si son pacientes encamados, nosotros nos acercamos con nuestro aparato.
Este aparato hace parte de un todo de telemedicina. Es un conjunto, un kit que tiene diversos aparatos de exámenes portátiles. Entonces, eso, por ejemplo, y estos exámenes pueden ser hechos por un paramédico o una enfermera y no hace falta que sea hecho directamente por un médico y puede ser llevado a cualquier lugar. Entonces, el profesional, vamos a decir, va a una comunidad aislada o en un puesto de salud lejano, hace los exámenes principales en los pacientes y transmite por internet a una nube. Cada examen genera un código. A través de ese código, cualquier profesional de salud, sea que esté en Valle P o Villarrica o Asunción, puede tener acceso a los resultados.
And also regarding other examples, we have already projects and running project in Brazil. We don't have a video so far with the subtitles. It is now only in Portuguese, but also in Irati, in Paraná State, and in Belo Horizonte, in Minas Gerais, we have running IDs2Go kits successfully.
For private and public customers.
And now we are going to show you the IDs2Go kit, and just to start, IDs2Go consists from actually the backpack with the devices, with monitor. It consists of our diagnostic IDs2Go application and of course the cloud IDs2Go. And now Sergey will help us to show. I will stop the screen sharing this presentation and you will see right now how it works. So here is the example of backpack with the patient monitor of IDs2Go. Please come closer, Sergey. And I will show you very quickly the exact workflow of IDs2Go. So here is the patient monitor. We are going to switch on it right now, and we have different languages already translated in IDs2Go. We have now here English, German, Polish, Spanish, Portuguese, Ukrainian, Russian. I hope I have mentioned everything, and we can keep translating. It is multilingual platform, and here you can see that we will start the examination. And before start, for example, I'm a nurse who is going to insert first of all the data about patient. So here is a phone code. First, here is a code of Austria, but we can use code of any country. We enter some numbers of code. Here is a field of patient ID. Here we can use patient real name and surname, or we can use any identification number, for example, medical ID card or insurance card number, whatever. Here now we will use name. Also, date of birth, we need to insert weight, height, date of birth. Weight and height is important for the interpretation of result, for example, from blood pressure. We choose gender, male or female. And also we can enter email of patient, but it's not obligatory field. So we are going further. After that, we are here on our main menu, and here we see all devices that are connected for our monitor. So let's start from some simple examination just to see the workflow for you. Let's start from something simple like thermometer. So to start the thermometer, I choose thermometer device here, and we see that it started to appear. Here is our infrared thermometer. Hope my temperature is okay. So we see the results here, and we see the results on the monitor. Save, and we see that it's already done, and the result is saved already, and we will go further. Let's do something like SpO2. SpO2 device, it is very important during COVID-19 to see the saturation of blood. In monitor version, the device of SpO2 is a part of the monitor, so it is very simple to use it with a finger. Here is my finger, and after some time we will see the result of SpO2. Here is, we see that it is normal, saturation is 99%, so it looks like I'm really healthy. And the pool that is above normal, because I'm hosting the webinar, it is more than 100. And we press save and going further. Let's make, let's measure the pressure. The blood pressure in a monitor version is also a part of a monitor. Here is a cuff. Here is my arm. And we are starting to choose tonometer device. Here is the screen of starting, and I press start measure. So it looks like it is okay because it is in green light. If it would be abnormal, it will be in a red color. And we see my systolic pressure is 122 and the diastolic 73. So I think that's super cool result for me. So. And we are continuing. So we press save after that on the monitor. And let's make something complicated. We will make ECG. ECG in the monitor version is also part in monitor. And now I will ask Sergey to help us, our engineer.
Yes, of course.
Here is the parts of ECG. We will show you now 4-channel ECG, because for 12-channel we will need to get close from Sergey. We will not do it today during our webinar. And we will use only his hands and legs. So, to show you how it works. So first we are connecting it to the IDS2Go monitor. Then we take each color part to the ECG strip, green by green, red by red, yellow by yellow, black by black. Please, can you take a seat? In normal situation, as you know, the nurse makes the measurement and the patient needs to lay down on some bed or sofa. So here we can see that we use it on black one on the leg, black on the right leg, green on the left, and on hands. So we choose ECG device on our monitor. Now Sergey need to keep calm for some seconds just to breathe, and you see the line is getting better. Normally, with this ECG, we can choose the recording for 30 seconds, 50 seconds, 10 seconds. Normally, we use 30 seconds, and to start saving, we press Start Saving. And here, we need to wait 30 seconds while the recording is doing now. You see, here is a second, so we can see on which second it is now. Sergey is calm, as you see with the ECG, and here it is recording. "30 seconds is done, and we can press save. After that, we are going back to our main menu, and if, for example, nurse want to see the results exactly on the monitor, not on the cloud, she can press show results, and you see that here you can see and analyze it if needed on the monitor. And the same with the other devices. If we want to see and remind us what was in the thermometer, we can go, we can press show results and see the results, or also we can see results of blood pressure. Okay, what else we have? We have Spirometer device. And to start it, we should choose Spirometer device on our monitor. Here is our Spirometer. And you need to make a breath in the device. After that, it is connecting on our monitor. Here is the results on the Spirometer. And now it is connecting to the monitor. Here you can see the results on the monitor. We can press save and all the results is in here. What is also interesting in Spirometer device, we can see show results and see not only the data with the numbers, we can see also the chart of the breath here. So let's go further. What we have in our basic IDIS2Go kit, we have Urine Analyzer. Very important device and diagnostic in a lot of kind of disease. And with this analyzer, we need to spend only 1 minute to see the 11 parameters of this device. We use the test strips, 11 parameters. It is an example of it. We are going in a monitor in an analyzer. Here. Sergey, do we have on these strips already some liquid?
Yes.
Sergey have prepared before, but in normal situation, we take the urina, we put it, the strips inside, and after that, we put it in the device. After pressing OK, it's starting the 60 seconds of waiting to start the reaction on the test strips.
And to make it more dry.
Yes, and to make it more dry to get efficient result in the Urine Analyzer. If you don't want to wait, we press OK the second time. And here we see the results on the Urine Analyzer. And of course, it is not the real urina. With real urina, we should see the all 11 parameters. Here is our example, like from what it was? From coffee. From coffee.
Juice.
From juice. So from juice, we see the results on our monitor. Here is some parameters, pH 5, for example. But on a real urina, we will see all ketones, bilirubin, glucose, everything here. So we press save, and the urine analysis is done, and we have the last examination of our basic kit device. It is a glucometer. So here is our glucometer. We choose on the monitor, here is a test strips. We choose on the monitor glucometer device and switch on the glucometer. You have already test strip. Please. So in normal way, we should get some blood from somewhere, but in our presentation, we will not get blood from Sergey. This time we will see how it works. Oh, you have a blood, Sergey. Sergey have well prepared and he got some blood somewhere. He is going to the device. It's like a drop of real blood from the finger. Hope it is not your blood, Sergey.
Close.
So the glucometer absorb the blood, and we see now the result on the monitor. It is 3.5. It is too low, yes?
It is great. It is great.
Sergey is great.
Result.
Okay, very nice. So now that there is people here around for now, and we press save. We have done all measurements of our basic kit. What else we can do? Here in the monitor, we have appendices, and here we see photo and audio. For example, if nurse want to get photo of patient of some disease, of some scratches on his skin, or some wound, she can press photo, and we are going to our camera, and we can make a photo here. So
this rear camera is.
Yes, it is real camera.
Rear.
Internal.
No, rear side.
Yes. And we have done the photo. Sergey want to make a photo of him. Let me do in internal camera with him. Sergey.
No.
So let's see. I see you. So we see Sergey in the camera. Okay. So we see here the photo of Sergey in our memory of patient.
For example.
We press save. Also, what we can do, we can make some audio recording. Here, we can tell something, the nurse or patient can tell something about his feelings, conditions, some comments.
Yes, this nurse, she so slowly. I would like to, next time you send me new nurse.
Okay, so stop the recording, and everything looks fine. We are going to, after we made all the examinations, we are going to end. To finish. We press end, and now we can go to examination list. Here you see Katie, female, 32 years old, and here is the unique code that was generated by each examination that nurse made generates a unique code. We use it, a doctor use it to enter in a cloud to see the results. And I will show you how it works right now. I will share my screen as like I'm a doctor who is going to see the results. So here is Google Chrome. We are going to our cloud. Now please come. It is to go online, not online. So here is our cloud. And please, here is the observation code.
8P 17M C6 6K 4766.
So here I want to see that was exactly the number that were unique code of this examination.
Just generated, yes, during examination.
Here you can see all the information that was measured from me. So subject examination, name, age, phone number, weight, height, gender. Here is a date of examination was completed, and ECG and time, yes. Serial number of kits that were used. Each kit has a serial number. And the results of thermometer devices here, the ECG, pulse oximeter. You see that my heart rate is a bit higher because I'm hosting the webinar, but the SPO2 is very nice.
It's great.
Urine Analyzer results, Spirometer, also you can see the details to go to chart and to see how it looks like. Also, what is important to see the details of ECG. Doctor can go to the details and apply different kind of filters, for example, tremor filter, low pass filter, and to see it on exactly this cardiogram. Also, you can see analytics when we are use the artificial intelligence with Minnesota protocol, and the doctor can see and analyze the results of artificial intelligence doctor decision support.
This reports about our engineer that he has no abnormalities.
Yes.
So he's looks like healthy.
Yes, here is temperature, glucometer, the photo of Sergey, spirometer.
And audio file.
Идем дальше. We are going to printable form. What is also very nice, the doctor can print the results and put it in some
even in paper card.
In paper card.
Or give in hands of patient with his conclusion.
Yes, right conclusion.
And signature.
Sign and stamp to a patient. So as you can see, doctor can be anywhere, any kind of place, and even any kind of country. We can perform also the Brazilian, for example, webinars, and I'm sitting here and show how it works. So that was a short demonstration, and start and continue to go further. I want to see your questions. And let's Sergey see the questions that people, our participants, writing to us. It is to go is working only in 5 countries right now, from Mr. Ahmed Sultan. It is to go is working now more than in 5 countries because we are very active in distributor cooperation mode. So is to go work in more countries, and it's registration, for example, in Kazakhstan. And we are now very active in Gulf region.
Austria already.
Germany.
Austria, Poland, Germany, Ukraine, Kazakhstan, Paraguay, Brazil.
We're opening more Latin America countries now, and actually it is now high demandable product because of COVID-19. It really supports a lot of spreading it in worldwide.
Yes.
And also what I want to tell that it is also makes simpler the process of importing of IDs to go. In some countries, for example, as Kazakhstan, it still needs some long procedure of registration, but in other countries they make the green line for all products that helps to prevent the COVID outbreak. For example, in Brazil, the country is very complicated registration system and a visa. Now we import IDs to go in Brazil without any obstacles from these authorities, no additional procedures.
They recognize our CE European certification.
Direct import, just our certificates, documents, and they give the import license for the importer, and everything goes very smoothly. So according to the situation, it really helps to make the direct import to the countries. Thank you. Go further. So to connect devices more than what we have now, what is the technical requirement? And what is the needed time from SK developers team to go live and add it to the platform?
It is a question for getting of example of a sample of device and SDK protocol, which we normally receive from manufacturer. So you can select device, then contact manufacturer, get protocols of transmission. Then development time runs up to 1 month. So it's not a problem. It is interesting to know which devices you would like to add, which diagnostic data you would like to, diagnostic functionality you would like to have, because we asking our customers and our distributors, and you see now the full range of already requested. Maybe you can think about another model of same device. It is interesting to know.
Yes, and I see also the Ahmed Sultan from Midwell Healthcare Egypt. Excuse me, I told you that you're from Oman. I see that Ahmed Sultan from Egypt. And here I see a question from Jamal. How you compare accuracy of your measurement instruments with top brands in market?
We use absolutely medical instruments. We don't use home care devices here in IDIS2Go platform and system. So we perform, in some countries, we perform complete another testing. For example, when we started for Ukrainian project, we passed through local metrology certification procedures. We spent 8 months with testing, technical testing, and visit of factories. So these devices which are inside, they are medical device, medical grade device. So absolutely the same. If the question with other brands, it is the same level of accuracy. International standard.
Yes, and I want to add to this answer that we are open to wire different devices. For example, as a stethoscope, you know that we have different, in the world it exists different range of stethoscope with different pricing. And we now have a Spanish pricing, Spanish-made stethoscope. Please let me show. Here is a digital stethoscope that we use now. And it is not very expensive model, but we know that we have in the world market as Littmann.
Yes, 3M Littmann model, which is 5 times more expensive.
Than IDIS2Go kit.
No, two times more expensive than IDIS2Go kit. But of course, upon request, we are going to wire more devices for dedicated markets. For example, Austrians asking about very expensive devices for EEG, and Germans asking for more expensive devices for dermatoscopy. We use dermatoscopy devices of $200-300 per unit, but doctors ask for dermatoscopy devices of €3,000 per unit to be connected. So upon request, we will do.
Yes.
Yes. Another question from whom? Bassam.
From Dubai.
From Dubai. Is the system compatible with the other devices or it locked to the vital signs devices provided by you? Inside system, yes, it is locked, because when we develop connection, we should guarantee the reliable connection and 100% of transfer of data. So we work on this and test all of this, and we guarantee that all devices work properly and diagnostic function works 100% correct, and all data transmitting, all data storing, and you use it. So inside the system, yes, it is locked. But as we say, we enlarge the number of devices. It's not a problem.
Yes, as a factory, we are responsible for the quality, so that's why we should be sure that it is already tested and we can give it to the user. Okay.
About privacy.
Mr. Weil-Lofty, how about the privacy of the info for patients? Because government hospitals will care about this point.
Good question. For this system, as it is telemetry, we easily avoid any problem with privacy, because when you insert patient data, you may not input personal data. The value of this unique coding of diagnostic case that you detect in the database, in the interface of cloud, you are searching not by personal data. You need not to use personal data to generate clinical case record. You searching in the database by code, and you can use only name, for example, and age, and don't put surname, don't put passport data. And you know that sensitive data, personal data, when you have name, surname, date of birth, and address, and passport ID or ID card code, and home address. If you don't use ID, if you don't use home address, you just type any code instead of phone number, for example, and don't use surname, only age, it is not personal data. We use age and sex information for calculations. That's why we ask for age and we ask for gender, yes, because our system should calculate the normal or abnormality. That's why you use the data, but it is not personal data. So, the answer, it is part of data, not complete personal. And you may create diagnostic case without any personal data, even without name.
Okay, so the next question, would you please more about implement process from Galaxy? The implement process is very simple. If we're going with a distributor to the market and we sign the distributor agreement, we start with a demo kit for distributor, we train the team of distributor with all necessary technical information on how to use, and the distributor go to the customers with ideas to go and make the study, to the nurses, to the doctors, and demonstration,
yes,
and support. It is very
and we
easy
give
to
videos,
start.
we give all manuals, we give operation manual, training video, we give separate manual for distributor team. So it is not an issue to start to distribute in the market. It is very easy and very already structured workflow.
We will go to the two questions and go further, because already a lot of time we are supposed to make it not so long, but lots of information that we want to share. So thank you, let's keep staying. And this next question, do you have any study for the platform and devices to be used to make our customer confident, from Ahmed Sultan? Please help us to understand better the question. Do you have any study for the platform and devices to be used to make our customer confident? You mean some research data about the using of kit?
To trust to the diagnostic data, or to, again, it is a question about personal data or sensitive data protection. What is the question about?
Yes, please clarify.
Please clarify. Let's go to another. So you confirm that it is possible to customize your monitor with available instrument in different countries. If it is valuable addendum, if it is requested by the market, yes, it is absolutely possible. Yes, Ahmed, I mean, study has been done in the some hospital. Yes, study has been done in hospital. What about patient, customer confidence? Please.
We can send maybe some articles from the hospital implementation that we have, for example, from Brazil, to send information to spread to your customers.
You mean reference, hospital reference? Yes, we have a lot of hospital reference.
Or from Ukrainian study cases.
We can send, no problem.
Yes, please write us up. By the way, after the webinar, you will receive the recording of webinar, and the email office is telemedicine is our email, and you can also write the questions, and our telephone we will leave in a chat in the end of our webinar. So let's go further. I will continue demonstration of my screen, and just to summarize about IDIS2Go, so where to use IDIS2Go, as you have understand before and from the video and from our discussion, that is absolutely different. Lots of places, ambulances, polyclinic, remote locations, rural areas, prison, police stations, some production plants, military units, and by the way, the good example is pharmacies. And for example, our distributor in Brazil used it in, he made some telemedicine cabins in pharmacies and used it kit to transmit the data from IDIS2Go from pharmacy points. And here is some user cases in any location of patient, or nurse can go to the office or somewhere where patient is right now. The main target groups, as we told before already, and during the COVID-19 is a really need. It is not in this slide, but it may be the first right now to avoid extra contacts of patients with chronic disease or elderly people with the infection. And as now we are here in our close webinar in English for people with the links, we didn't do the promotion for this webinar, only we use the links by invitation, because here is our potential distributors, and we've made the distributor account because of course it is important to manage the IDIS2Go kits. And just to make a small overview, that as a producer, the manufacturer, we create the distributor account, and an email you will receive this invitation, and you will go to the IDIS2Go account of distributor, and you will see information about your kits. You can create customers there, for example, hospitals. You can make your manager of your account. You can see all kits that you have. You can see all customers. You can see all the devices, all the services that you're providing, and all movements of kits, for example, from manufacturer to distributor, so where it is right now, in which customer, and you can see and add your activity, and you can also
customer activity, user activity.
Yes, here is on this circle, for example, it is a circle with a number of examinations that monitor your kits, and which examination they use more, which less. And also you can tell to your customer that they also can use customer account. After you create your customer also can receive invitation email and come and also manage. Hospital can manage by themselves the account of customer and see which ID2Go is connected to which doctor. And in a customer account, customer will see the history of all unique codes that were generated by IDIS they're using. So they can see it like a memory and to see everything that were made in this hospital with ID2Go. So it is very useful tool for distributor who work with many customers to manage the kits, to see how everything is going on, and then to charge. We will tell about charges also after that. And so we are improving also this account of distributor, and will we grow, we will see more and more statistics, more and more information about ID2Go, and now it's also very useful. So we create the distributor account after signing that the ID2Go agreement, and you can use it.
Distribution agreement.
Yes.
Yes. So I think it's enough information at the moment.
About ID2Go.
Yes. The main scenario, if you would like to become a distributor, you purchase demo kit after signing of NDA and distribution agreements, and we start planning market activities together and start showing, selling, making money together.
And let's tell a few words about the model. What is good as ID2Go? It's not a one-time deal. It's not a one-time deal. It's not only one-time sale that you sell it to customer and that's it. No.
Yes, business model is of course, to make money to sell the system as a diagnostic kit. And the second, it is monthly cloud fee. We also we have recommended level, and you sell it to customers, to clinics, and of course with using distributor discounts. So we all make money. A clinic makes money with diagnostics, and you makes money selling of kit and collecting monthly cloud fee, and this is continuous running business, not single sales action. And of course, supply of materials for these strips for glucometry, strips for Urine Analyzer, and other single-use materials for other reagents, for other laboratories we also include. So it is business making money 3 times. First time selling of system, second time continuous selling the cloud service, and the third part is supplies, final supplies.
A question that I see, is it possible to customize and develop software? Yes, according to the country requirements, we can make some customizations of...
If necessary, to make interface in Arabic or other language, of course, we should adopt a user interface in diagnostic app and in the doctor web app to local language. Yes, it is possible. We plan to do it for Arabic languages for sure.
Yes, it also, and now in English, for example, it works to start.
Yes.
And so it's just to summarize the ID2Go information. We have showed you how it works, the examples of using worldwide, and the main idea, how to implement it. And we want to tell a few words more about another product. Of course, this another product, it counts a separate webinar that we for sure will host very soon. Next week, we're hosting it in German language, but we will inform you about English for sure. But now, just using that you're here, a few words about show to doc, doctor to patient communication and monitoring platform. ID2Go was a telemetry system, and here is a telemedicine.
Let's say ID2Go, it is medic use diagnostic system, because always it is trained personnel which use it in the point of care, in the office, doctor's or nurse office, or at home or somewhere else. But Shotodoc, it is direct patient-to-doctor communication platform, and it is very important. This functionality we developed already 1 year, but now the level of functionality 100% fits COVID tasks, because COVID monitoring task is daily or even hourly monitoring of changes of patient symptoms, of disease symptoms, because COVID is very dangerous with hidden symptoms which are shown only in the last stage when lungs are already burning and the status of patient, his health status is falling quickly. And to avoid such heavy scenario of this disease, it is very important to detect breathing functionality and temperature, first two, temperature and breathing tests 3 times a day, 4 times a day, and without a lot of doctor time, without calling to doctor, talking to doctor, video calling to doctor. Because it takes a lot of time, and when doctor takes care about 100 of people or even 20 of patients, it is part of his life to spend on video calling, asking them about status. But Shotodoc allows like a subscription, monitoring subscription, when doctor appoints activities of patient to measure temperature, to take a pill, to measure SpO2, to make breathing test, to describe his symptoms like coughing, for example. And it is gives more discipline for patient and allows to early detect the changes of status, changes of symptoms of patient. So this is, we feel, very attractive tool, a medical instrument to be used by thousands of doctors for millions of patients. Of course, we will perform separate webinar.
It is separate hour.
Show how it works and give you idea of business model of this product.
So the coronavirus crisis will end, but telemedicine will continue, and we invite you to be part of family of Telemed. And with the products of Shotodoc, ideas to go to help to save the world from COVID-19 outbreak. And also a few words that we have a possibility to sell the coronavirus tests. So we have rapid tests and we have antigen tests that also help to fix in 15 minutes the appearance of
yes, it is new
virus.
recommendation of World Health Organization, not antibody rapid test, and easier, smarter than PCR, because you need no special big laboratory to process. And this is 15 minutes test, which detects antigen of virus from first day of infection.
Yes, and as I promised that in the end of the webinar in the chat, I am writing my phone number with WhatsApp, and also you can absolutely feel free to ask some questions after the webinar. And we want to say thank you for spending this almost 2 hours with us, and hope it was useful information for you, and we are open for cooperation.
Yes, welcome to fight against COVID epidemic together, and I'm sure we will add value to health care of your countries and save lives, for sure. Thank you very much.
Thank you very much. It is end of our webinar, and see you very soon on other webinars that we will host and continue to speak about things. Thank you very much. Thanks for participating and for hospitality. Thank you.
Thank you. Bye-bye.
Bye-bye.